Now let's turn to dengue fever. Dengue fever is a viral disease that shares many commonalities with yellow fever. Both belong to the flavivirus genus. Both are vector-borne illnesses by the Aedes mosquitoes. Both have natural reservoirs in humans and primates. Dengue fever is the most common arthropod-borne viral disease in the world. Globally, 2.5 to 3 billion individuals live at risk for the illness across 112 countries in the Americas, Africa, Asia, and Australia, resulting in 50 to 100 million new infections a year. Population growth, overcrowding, poor sanitation, and ineffective mosquito control have all led to an expansion of the geographic distribution of dengue fever and a subsequent increase of worldwide incidence. Like yellow fever, the symptoms of classic dengue fever manifest themselves after a short incubation period of 5 to 8 days and unfold in 3 stages. The first stage is known as, quote, breakbone fever, and is characterized by the acute onset of fever, headache, retroorbital pain, and severe myalgias and arthralgias for 5 to 7 days. Hemorrhagic manifestations due to thrombocytopenia are common, including purpura, petechiae, scleral ecchymosis, shown here on the left, epistaxis, and gastrointestinal bleeding. Other associated symptoms include rash, as shown on the right, cough, sore throat, nasal congestion, nausea, vomiting, and diarrhea. The second stage is a period of remission, whereby fevers resolve, but significant fatigue can last for days to weeks. The final stage is known as, quote, Saddleback Fever. It is seen in a minority of patients with classic dengue fever and is marked by the resurgence of fevers for 48 hours. The feared complication of dengue fever is the development of dengue hemorrhagic fever, or DHF. The WHO have developed 4 criteria for the diagnosis of DHF. The first is marked thrombocytopenia, less than 100,000. The second is hemorrhagic tendency or spontaneous bleeding. Hemorrhagic tendency is measured using the tourniquet test, which is performed by inflating a blood pressure cuff to the midpoint between the systolic and diastolic blood pressures for 5 minutes and observing for the appearance of greater than or equal to 20 petechiae per 2.5 centimeters squared. The third criteria is plasma leakage syndrome, which is due to increased plasma permeability resulting in greater than or equal to 20% rise in hematocrit, pleural effusions, and or ascites. Another component is fever, and lastly, in severe cases, this can further progress to dengue shock syndrome with hemodynamic collapse, carrying a mortality rate of 12%. Dengue fever is generally a clinical diagnosis. When available, serologic testing is the initial diagnostic test of choice, though false negatives may occur early in the disease process, less than 1 week. Therefore, if clinical suspicion remains high despite a negative serologic testing, antigen testing for viral RNA or NS1 antigen should be obtained given higher sensitivity, 50 to 70% during this time period. Treatment of dengue fever is supportive care, particularly with volume repletion and blood products should plasma leakage syndrome or hemorrhagic manifestations occur. Vector control is the most effective preventative measure available against dengue fever, which includes protective clothing, insect repellent, and targeting mosquito breeding sites. No vaccine against dengue fever is available at this time.